Good afternoon, delegates. First of all, very big thank you to the AIOS committee for inviting me and giving me the opportunity to speak today. And a special thanks goes out to Dr. Namrata for inviting me as well as the chairman of the scientific committee. I am from Calcutta. It's very nice to come back home and deliver this talk along with some other esteemed guest speakers. So without much ado, application of artificial intelligence. This is really interesting because I learned a lot while making this presentation. So this is where I work. I come from United Kingdom and I work in Aberdeen in Scotland, and that's my hospital. So going into the topic itself, artificial intelligence first develops its roots in the Dartmouth summit in the 1950s, when there was this concept of development of computer systems being able to perform tasks that normally a human brain would do. And things like visual perception, translation between languages, which we actually see in our everyday life nowadays. We ask Alexa to do something, or Siri, and it does it for you. They tell us what the weather is going to be, and so on and so forth. The chat GPT, many of us in this room might be aware of it. So things like these are gradually entering our everyday life, and also in the field of health sciences and in ophthalmology in particular. This is a fun slide just for a concept what AI can do nowadays. So the top picture is no other than the famous painter, Vincent van Gogh, which we all know, created by AI. The bottom left is a robot, Kismet. Many of us might know this. He was very popular in 1990s, and it was meant to mimic human emotions. And I was recently at the American Academy meeting in California, where I saw cabs without a driver, the Waymo. So these are the applications of AI in our everyday life, and they are indeed very helpful if used intelligently and usefully. Some basic concepts about artificial intelligence, what it is, because it's a relative new concept. So it's a problem-solving exercise for softwares that mimics the cognitive functions of learning, and the machines process and recognize patterns from large data sets and make up a model, which normally a human brain would do and give us a result. In ophthalmology, we are unique because we're technology-based, imaging-based, and there's enough scope for the application of AI in ophthalmology, which we'll see in the next few slides. I don't want to bore you with definitions, but these are essential ground rules of AI, and I'll keep it very simple. For me, it was, like I said, a steep learning curve for myself to learn AI. So deep learning is a class of machine learning algorithms, and it's a computation to the artificial neural networks, or processing and learning from large amounts of data, which uses neural networks, which is nothing but a computer system modeled of the human brain and the nervous system. All together, a network of neurons communicate with each other and outputs the data. And machine learning takes in both of these into account, and it's the capacity of the computer to learn from trial and error and formulates a perfect model. And this is the pictorial representation. So we have got deep learning on the left and neural networks on the right. Together, they form a machine learning from large amount of data sets. Just for example, lots and lots of fundus photos. And they learn from trial and error, which is normal, which is abnormal. And they create an algorithm, and in turn creates a model. And that is artificial intelligence all under one umbrella. In ophthalmology, we'll talk about glaucoma in the next few slides, but it has its application in other specialties as well. For example, detection and gradation of cataracts. In medical retina, it has a special role, which is coming up very fast and quick, is to stage diabetic eye disease, for example, or to stage retinopathy of prematurity. And in cancers, it can classify choroidal melanomas and see how the outcomes are, or in reconstructive surgeries for basal cell carcinomas. So there's a lot of evidence out there in the literature. The top one is artificial intelligence algorithms to detect glaucoma and detect the progression and diagnose glaucoma. The bottom one was done between the Imperial College London and the Singapore National Eye Institute. That's a very recent article which I found very, very useful. If you're interested, you can go back and look at that. It's a very interesting read. It compared 3 specialties: respiratory diseases, ophthalmology, and breast cancer. And we stood at par with the other specialties to see how important and how useful AI can be in the field of ophthalmology and in glaucoma in particular. Some terminologies, again, not to bore you too much. We all know what on the right-hand side, the 3 definitions are. Accuracy means how accurate a model is in terms of prediction. Specificity is the capacity of the model to detect the true negatives and sensitivity is the true positive. And anything above 90% is regarded as a highly accurate model or an algorithm. The interesting one is on the left, which I learned myself. It's the AROC, or the area under the receiver operating curve values. And if it's more than 0.7 up to 1 is the max, then a model is regarded as highly accurate. And we'll come to that in the next few slides. I'm sure few of us, or most of us, know what this picture is about. This is a triggerfish, which has got two fins on the dorsum. The back fin triggers the erection of the front spiky fin when there's a threat of a predator. And that's what has been employed in the triggerfish, which we use in glaucoma world. As we all know, the corneal strain gauge on the contact lens, and that triggers off and senses ocular volume changes, and in turn, intraocular pressure changes. And it's got a definite role where AI comes into play in measurements of intraocular pressures. So there has been triggerfish data with meta-analysis to identify parameters that are important to understand the underlying disease process. For example, in normal tension glaucoma, what actually makes the changes happen. And it's got a place, as you can see here, this is the NICE, which is the watchdog of healthcare in the UK, and the triggerfish data has got a place in it. So these things are evolving gradually. Every few years, there's a new development, and these have got a definite role to play in the future. The next few slides will be in the structural and functional evaluation by the AI and how we can put that in everyday practice. So we've got the optic disc evaluation. These are the three major studies that I picked up on. The Lee et al. Showed more than 95% specificity and sensitivity to pick up glaucomatous optic discs compared to normal ones. The Pegasus is a similar model designed at the Al Aswad, does the same thing. Has been found more than 5 out of 6 times. It's better than a practicing ophthalmologist to detect glaucomatous discs. And the last but not the least is the RIA-G, which is an Indian company, the Calf Innovations, which designed, again, from cup disc size, NRR, CDR ratios, and it can have a very high AROC value, which means very high accuracy of the model to detect pathological glaucomatous optic discs. This is a very busy slide. I don't expect you to read through all of it, but I just want to attract your attention. So it keeps on saying the same thing. So the vertical cup disc ratio more than 0.9, RNFL defects, visual field defects, all of them together makes the model more robust and helps a more accurate prediction if the person or if the disc is glaucomatous or if it's normal. Which means we just move on to the next bit, which is the structural evaluation by the OCT. And segmentation, that's another key word in AI. So super segmentation and deep learning of the OCT images, which are tens and thousands of images, will in turn help to spot which is normal and which is abnormal. And they all combine in together in the weaving of the same kind of endpoint, creating that ideal model where we want to see if the disc is pathological or not. And if you combine it with the functional aspect, which is the visual field study, so lots of visual fields, the pattern of glaucomatous patterns are detected, and in turn, the machine will tell us exactly how it's going ahead. And that's the evolution. On the top, you can see a glaucoma specialist feeding into a machine and creating abnormal and normal diagnosis. And the bottom one is the deep learning, the end-to-end deep learning model, where you just feed in all the data, and it comes out as, without the help of any ophthalmologist, it comes out as abnormal or normal. And that's the theoretical workflow, where on the top, the primary care provider, which are optometrists, they can gather all the 3 data that are in question, feed it into the machine will tell at least these are not glaucomatous discs and they can be discharged in the community. That keeps the workload in the hospitals, in the secondary cares to a minimum and deploy the actual potential to treat patients who have got the pathology. And there are immense possibilities, as you can see here. I don't want to read out all of them, but from early diagnosis to research and development, it can be used in several ways to our advantage, AI. It has got its pitfalls because glaucoma is such a condition which is multifactorial, age, gender, sex, and different parts of the world varies from one part of the world to other. So a perfect model is yet to be created. However, we are not far away. So standardization algorithms, clinical validation, and regulatory approval are necessary. And this is the summary. So we can use AI to our advantage to create the perfect model. And once it has passed the regulatory approval in different parts of the world, we can create the perfect setting where we can just flash a smartphone and say, at least this disc is not glaucomatous, you can go home, or please go to the hospital. Friend or foe, time will tell. And this is my final slide. So on the left, we had an AI Summit of the World headed by the United Kingdom. And on the right is my departmental colleagues and members of the glaucoma team whom I work with in the Aberdeen Royal Infirmary. Thank you.
Thank you so much. So yes, there may come a day when AI will maybe help us to diagnose glaucoma all in all, but as we all know, it requires a lot of factors, intraocular pressure, optic disc, visual field. So we have to develop algorithms for all of them connectively. And also we have in countries like South Asia, Southeast Asia, where angle closure is very common. So that's another thing we have to consider, maybe AIOC-based diagnosis for angle closure, because some of them may have normal discs and they may need some sort of treatment. Any questions from the audience?
Next, thank you very much. That was very